You know your dog's routine perfectly. So when your completely house-trained female dog suddenly leaves a puddle on the rug, or she stops to strain for a long time on her afternoon walk, it immediately catches your attention. It's easy to shrug off these little behavioral shifts. We tell ourselves she drank too much water, she's getting older, or she's just acting out. But these subtle cues are often the first indicators of a urinary tract infection, or UTI. She is in physical pain, and she has no way to tell you. Dogs instinctively mask their discomfort. Catching these shifts early is how you stop a bacterial infection before it migrates deeper into her system. A UTI occurs when bacteria colonize a normally sterile bladder. This happens when external bacteria, most commonly E. coli, manage to get inside and multiply. To see why female dogs are disproportionately vulnerable, look at this anatomical comparison. The female's urethra, the tube carrying urine out of the bladder, is significantly shorter and wider than a male's. Because the female urethral opening sits in close proximity to the anus, environmental bacteria have a direct path straight into the bladder with very little distance to travel. Her biological structure makes her uniquely susceptible. A minor exposure to everyday bacteria can rapidly bypass her physical defenses and reach the bladder. If that bacteria is left untreated, the bladder lining becomes highly inflamed. This inflammation tricks the dog's brain, sending signals that she has an urgent need to urinate, even when her bladder is empty. As the bacteria multiply, the signs become more apparent. You'll see blood in the urine, a cloudy appearance, a foul odor, and visible distress whenever she squats. There is one distinction that changes the nature of the situation entirely: the difference between an infection and a physical obstruction. This diagram shows what the urinary blockage looks like. If your dog is intensely straining to urinate, but absolutely nothing is coming out, a solid mass, like a bladder stone, has completely plugged the exit. A zero-output blockage is a life-threatening medical emergency. It requires immediate professional veterinary intervention. While a standard UTI causes pain and inflammation, a complete blockage is a mechanical failure. If fluid cannot escape, the bladder can rupture within a matter of days. Clinical testing is the only way to confirm a diagnosis. Because these symptoms can mimic several different conditions, targeted testing is required to find the actual cause. This is a microscopic view from a urinalysis. The vet screens the physical sample specifically looking for microscopic blood, white blood cells, and crystal formations. Next comes the urine culture. The clinic takes a sterile sample and grows the bacteria in a lab for a few days to identify the exact microbial strain involved. Identifying that strain allows the veterinarian to prescribe an antibiotic matched to the specific pathogen. Clinical testing provides a specific pharmaceutical target. It ensures she receives a treatment that actually works against the bacteria attacking her system, rather than relying on guesswork. The medical reality is straightforward. To eliminate a bacterial colony inside a bladder, you must kill it using a 7 to 14-day course of veterinary-prescribed antibiotics. A true medical cure eliminates the bacteria, while supportive care only manages her comfort while the medication works. Avoid the use of human over-the-counter UTI medications. While they might relieve human pain, those chemicals and dosages are often highly toxic to a dog's system. Pantry staples follow the same rule. Feeding your dog apple cider vinegar or coconut oil does nothing to sterilize infected bladders. Treating a bacterial infection with home remedies gives the pathogen time to travel up to the kidneys, where it can cause permanent damage. Supportive home care is highly effective when paired with antibiotics. Increasing her water intake physically dilutes the urine and helps flush bacteria out of her body. Give her frequent potty breaks. This prevents stale, bacteria-laden urine from sitting in her bladder for hours at a time. Maintain strict physical hygiene. Keeping her genital area clean and dry prevents environmental bacteria from restarting the infection cycle. Once the active infection is fully cleared, vet-approved supplements like cranberry extract or D-mannose can be used preventatively to make the bladder wall less hospitable to new bacteria. A female dog's anatomy makes her susceptible to these infections, but staying alert to her behavioral changes allows for prompt diagnosis. This proactive care keeps her healthy and comfortable.